Okay, Sunita, if you're ready to go.
Thank you. Good afternoon, everybody who's joined our live seminar today. My name is Sunita Chakrabarti. I'm a clinical lead. I'm a doctor looking after women and children, and I work for the Bedford, Luton, Milton, Keynes CCG and integrated care system. And I'm also a clinician in the patch. Today, our webinar is on giving you information around the COVID-19 vaccination, particularly for women who are pregnant and who are also breastfeeding. We will take questions as we go along. We've got a panel who I'll introduce in a minute. And we're very keen to hear from you with any questions that you have so that we can guide you around the COVID-19 vaccination. So without much ado, if I could just introduce the panel we have with us. So I will put myself on mute and I will pass on to Jane.
Thanks, Nita. Hello, I'm Jane Piggott, Public Health Midwife for the BLMK, so Bedford, Luton and Milton Keynes, and work alongside Sunita.
Okay, should we go to Elizabeth next?
Hi, I'm Liz Fitzgerald. I work with the communications team.
Fantastic. And then we have got Dan.
Hi, this is Dan Abiziaka. I'm also with the communications team and providing technical support today.
Fantastic. And then can we have Esther, please? If you're talking, you're on mute, Esther.
I went to unmute.
Okay.
Sorry, IT problems.
That's okay. Can you hear you? We can hear you. Go for it.
Okay, so I'm Esther. I'm the infant feeding lead at Bedford Hospital.
Welcome, Esther. And you've got a colleague with you?
Yes, I'm Louise Preston. I'm the interim deputy head of midwifery at Bedford Hospital.
Welcome, Louise and Esther. And Louise and Esther will be taking questions as we go along. So thank you, everybody. And thank you to everybody who's joined us today. So we will, I will use the first couple of minutes to give you some valuable information around the COVID-19 vaccine, in particular relevance to pregnancy and breastfeeding. We will cover some information about the COVID-19 infection as well, and why the vaccine is important, particularly when you're pregnant. And then we will cover some grounds as to how to access the vaccine when you are pregnant and you're breastfeeding. Next slide, please. Thank you, Dan. Okay, so that was the content. Next slide, please. So there is a lot in the media and on the news every day about the COVID-19 vaccine and the COVID-19 infection as well. The COVID-19 is caused by a virus. It's not visible to any of us. It spreads through sort of touch and our secretions. Hence, we've all been trying to wash our hands, wear masks, and make sure that we don't spread the virus. There are lots of viruses. And the list of viruses, viral viruses that cause infections is on the slide. So vaccinations that we have for measles, mumps, rubella, influenza, hepatitis A, B, they're all, diseases that are caused by viruses, and we have vaccines for all of them. So just to allay people's anxiety that COVID-19 is yet another of those viral infections, and the COVID-19 vaccine helps us with the infection, giving us antibodies for it. Next slides, please, Dan. Okay, a little bit about the coronavirus. Again, you would have seen a lot in the press, but we'd like you to keep to the reputed resources for any information that you need. On the left, you can see a picture of the viral particle, and the red bits is what we call the spike protein. A spike protein is something that you hear a lot about. So basically, it's called a coronavirus because the spikes form like a crown-like feature, and that's why it's called a coronavirus. The vaccine and the aim of the vaccine is to work, to develop antibodies which can then destroy the spike protein, which then destroys the virus. So that's how the vaccines work, but we'll come on to that in the next few slides. Next slide, please. Okay, so when did it start? Again, it started some time ago, as we know from China. It's now a global pandemic. Majority of the countries of the world have got cases of and clusters of infection. It's causing devastation in many parts of the world, including the United Kingdom, so there is a range. People can become symptomatic and then deteriorate very quickly into quite morbid situations where they need hospitalization. As the virus is changing, we are seeing the pattern changing. It was affecting the elderly and the most vulnerable before, but more recently we're starting to see more younger people get infected and requiring hospital treatment. So it's very, very important, as the vaccine is opening up to the younger age groups and even to pregnant women. It's very, very important that we make sure we get the vaccine because that gives us antibodies. Because just because we are young and healthy doesn't mean we have antibodies to it and we have the protection to ward off the infection, because the infection is quite debilitating. Even if it doesn't cause severity in terms of hospital admissions, it leaves with quite long-standing problems. Moving on, Dan, next slide, please. So why pregnancy and why are we recommending the vaccine to pregnant women now? We were waiting on information coming in and the experience coming in, and now we have substantial information, particularly from United States, where over 100,000 pregnant women have been vaccinated, particularly with the Pfizer and the Moderna vaccine. We are now more confident that giving the vaccine to pregnant mums it helps them to not get the infection. Because what we've also seen over the course of the pandemic, even in our country, that pregnant mums, when they get the infection, are suffering quite a lot. Now, pregnancy in itself is not a great risk of developing COVID-19. However, as the economy opens up, as our children are going to school, pregnant mums are doing school runs, going to supermarkets, we are vulnerable to exposure to the infection, and having the antibody not only protects the mums from getting the infection, but also protects the newborn. And that is why it's quite important that we now thinking there is recommendation that the pregnancy, the COVID-19 vaccine is recommended for mums. The recommended vaccine is, of course, the Pfizer and the Moderna. Moving on next. Okay, so this is about the vaccine. So what does the vaccine do? It produces the same immune protection that would follow, if you were going to, it gives you the antibodies against the spike protein, as I was talking about. And it prepares the immune system to respond rapidly, so that if you were to develop any symptoms, then then you don't you don't kind of develop severity of the symptoms, and you don't end up in hospital. It's very, very difficult for us to treat pregnant moms when they if they need hospitalization, because they can't breathe, and because they're carrying a baby, the diaphragm pushes on the lungs, which means there's not enough capacity of the lungs, which stops them from breathing as well. So so it becomes very, very difficult to treat mums. So the best thing would be for mums to have their antibodies and to ward off the infection where possible. One thing that has also come to light is that even if pregnant mums are socially isolating with somebody and they're asymptomatic, but they eventually then develop their PCR test comes back, or the test comes back as positive, there is a small chance that the newborns are then requiring support after the baby is born. Now, it's very early days. We're still studying all of this. So which means that, the vaccine, the infection, the COVID virus, not only causes the infection, but can also sometimes affect the baby, the unborn baby. So it's important that if you have immunity from the vaccine, then it protects a mum as well as baby. The vaccines are safe, and as said, we know for sure from the evidence that we've got so far that the vaccine can be given, at least the Pfizer and the Moderna can be given, because we've now got that information from the US that these have been given without any problems. Okay, moving on. Okay, so this in a nutshell talks about how the vaccine works. So if a vaccine is delivering the antigen, your body produces the immune response, which basically develops the antibodies, which are these cells that go and gobble up and eat any viruses that you are being exposed to. How do they do that? They work on those spike proteins and they basically gobble them up. What it also does is then it gets the memory cells activated, so your body then has a memory. So anytime the virus comes in contact with your body, your immune system can fight it off. So that's the way the vaccine works. Next slide, please, Dan. Okay, so this is quite a busy slide, but these slides will be put up on our website so you can look at it in your spare time. There is a very, very stringent and a rigorous regulatory process before any vaccine or any new drug gets authorized to be given out. And hence the Pfizer, Moderna, and people who've had the AstraZeneca, these vaccines have undergone very, very stringent and regulated scrutiny before they've been put out for us to have them. And many of us have had them. Colleagues who are on the call we've all had ours, the first and the second dose, and that is why, and that the safety is not as if it's something that's taken easily. And more importantly, every week we then analyze all of the vaccinations that's been taking place and any side effects that are coming out through it. And so far, we've had 76% of our population vaccinated across the country with their first doses, and over 65% with their second doses. And the side effects, other than the blood clots, which have come to light in a very small group of people with the AstraZeneca vaccine, have been very minimal. So just on there to say that the vaccines have been recommended after a lot of scrutiny, and when we say that it's safe and effective, there is a whole regulatory process making sure that that's being monitored as well. Moving on, Dan. Okay, this slide talks about the vaccine, the COVID-19 vaccine, and the trials and how they've come onto light, but I think I've touched on that. Moving on, Dan. So the Pfizer, BioNTech, and the Moderna vaccine are the are the vaccines recommended for pregnant mums. And this slide talks about the two vaccines, and then talks about how they're developing the immunity in our system. Both are, if you've heard of different types of vaccines, these are mRNA vaccines. Couple of things to just reiterate here, because there's a lot of social media messages which are not correct. So the mRNA vaccine does not cause any long-lasting changes in your system, okay? Because there's social media messages saying that it'll alter your DNA because it's called mRNA. It's got nothing to do with that. The mRNA element is just a vector. It's just a mode to get the antigen into the body. After that, your body basically metabolizes the vector, and there is nothing left behind other than your own antibodies that your body produces, which then wards off the virus if you're in contact with it. So that is very important to remember, that please be careful of the messages that you read on social media, because not all of them are true, and many of them which says that it'll change your body physiology, it'll not, and definitely will not change anything within the unborn child. Moving on. Okay, and then it goes on to talk about the each of the vaccines and the characteristics of it. Moving on, Dan. Okay, so this is the recommendation for pregnancy and breastfeeding. So the Joint Committee of Vaccination and Immunization, which is our national body, which is the regulatory body which regulates all of our vaccines, and particularly our new vaccines, have recommended that pregnant women should be offered the vaccination at the same time as the non-pregnant women. We are now vaccinating everybody 30 and above, I understand. So there will be pregnant mums in there. So we would encourage you all to book into the national booking system, and my colleague Jane will talk about it. You could, if you wanted to have a discussion about the vaccine and the risk and benefits, you could talk to your midwife about that, and they will be able to help you with that. Mums who are breastfeeding, it's very safe for breastfeeding mums to also have the vaccine. Again, talk to your GP or booking through the vaccination portals, the national vaccination portals, and you should be able to get the vaccine as well. Moving on, Dan. Okay, we've put a lot of links on here, and there is a lot of patient leaflets and information that you can access, and we put these links on here. We will put them all on our website as well. If in doubt, always talk to your midwife, who should have all of the information to give to you as well. And please, can you go to the reputed resources to get any advice and information that you need for the COVID-19 vaccine. Okay, couple of last minute, sort of sound bites from me, really. Things to take away. If there is nothing that you've remember from today, remember a few things. The COVID-19 vaccine is recommended for all pregnant women and for women who are breastfeeding. And it's very important you get it, because pregnant mums suffer a lot if they encounter the COVID virus and the COVID infection. It's very important that even if you have the vaccine, even you go for the first and the second dose, because the efficacy comes after the second dose. So it's very important you go for both the doses. Even if you have the vaccine, does not mean you can let your guard down and stop washing your hands, wearing your face mask, and not keeping social distance. It's very, very important that the vaccine is considered as a part of the other safety measures that we have in the community. So you have to continue to wear your face mask, keep washing your hands, and keep your safe distance of 2 meters, and go by all the social distancing rules. So, mixing households. If you're in an area, particularly if you're a mum in Bedford, be careful about the messages that's come out around your social distancing rules. So it's very, very important you keep to your local rules around social distancing. It's very important to know that some of the newer variants, you know, our children are in school, and we know that sometimes infections come from children in school. So be very careful to make them wash their hands, keep their hygiene, wash their faces, and you know, when they come back from school, so that we are minimizing the spread of the virus. This virus is very scared of soap and water, so and alcohol gel. So it's as simple as that. Okay, that's all I had to say for now. I think there are some questions coming in, which colleagues we will pick up, but we encourage you to post your questions so we can answer them as we go along. Okay, is that all right then, Dan? If I could hand over to my colleague Jane Piggott, and I will put my camera off and I will take your questions. My colleague Jane Piggott will take you through the process of how to get the vaccine. Over to you, Jane.
Thanks, Nita, that's fine. So Dan, could I possibly get the RCOG risk assessment leaflet that we sent through up on the screen, but I will just talk briefly. So yes, when the JCVI changed the recommendation, as Sunita said, around pregnant women and their vaccination, we've had to work quite rapidly with regards to making sure women have the right vaccine. We've worked closely with our vaccination centres to make sure that when women did book in, that they're actually getting the appropriate vaccine. So you can see on here that it tells you what you can do and what links you've got, and this will be communicated on social media later today. So you've got links on there that can aid you to make your decision about whether you want the vaccine or not. And then it's also got the link at the bottom for you to then link onto the NHS website to book your vaccine. Now, when they first launched that pregnant women would have the vaccine, they didn't have this a bit of access availability on the website. We had to do a very manual process. So now when you book on the national website, it will say, are you pregnant? You tick that box and that will make sure that you're allocated to the right vaccine. What it also does is it picks up on your history of vaccination. So if it's your second vaccine that you're booking and you've already had one, it will match you to the same vaccine. So therefore, I would presume one of the questions that may come up in a minute is the fact that if I've already had AstraZeneca in my pregnancy or pre-pregnancy, am I safe to have it in pregnancy? And the answer would be yes, if you haven't had any serious reaction to it or any side effects, and that's more than just an aching arm or the common effects of the lesser effects of COVID. We're talking about the issue with around blood clots, which again isn't actually as severe for the risk that we're looking at for pregnant women, but we're advising that if you've had the adverse outcome, then there's a different strategy we should take. But if you have had it and you've been okay, you should follow with the AstraZeneca's vaccine for your second vaccine, and the website will be able to pick up on what vaccine you've had previously. Any queries at all about the vaccine? Do not book your appointment online. Make sure that you go to your midwife, GP or your obstetrician and you speak to them about the vaccine. You look at the resources we've quoted on here today. So the RCOG is a very key one. The NHS website is another one, and the public health .gov.uk website is another key website for you to look at for leaflets. They offer certain things in different languages for you to aid your decision. If you were to turn up to the vaccination centre, they will not be discussing the risks and benefits of the vaccine in pregnancy, because they are just vaccination nurses or people that are there to vaccinate. They're not there to discuss pregnancy. So please, the other key point, I know Sunita's listed a few, the other key point for me is please do not book your vaccine unless you are happy to proceed with that and you haven't got any other questions. If you've got questions, you need to speak to a healthcare professional that looks after your pregnancy before you book that vaccine and attend. So I hope that's clear. And then Dan, there's the other leaflet is the RCOG leaflet. Could you possibly put that up? It's the decision aid tool. And it just demonstrates the little leaflet that goes through, and it's available online. Quite a lot of people refer to it, so it would be something that you can then see. Brilliant. So as you see, you just go through it and you just literally scroll through. It tells you a lot of a bit of this information, and it's very informative as to why you should have it, the risks and benefits around having it, and how you should have it. So it's very clear, very concise, and it's reliable and informed information. It's not anybody's opinion, it is factual, it's correct, and it's reliable. So that's what we're saying to you. Make sure your sources of information are reliable. So that is basically everything from me with regards to the vaccine. As I said, if you're happy to book it, you can book online on the nhs.uk website and you follow it through with your details, and that then becomes your record. They pick you up quite easily on that website. You don't need your NHS number, but if you've got your pregnancy information, you probably have got your NHS details to hand, and then you follow through. If you have any questions, speak to your midwife, GP or obstetrician beforehand. Okay, so I think we'll move on to the questions. And I think we may, I know we've seen some comments on social media saying that people have struggled to get onto this call, and I know we're actually recording it, so we will communicate it afterwards. So we may have to go, Esther, with and Louise, with the questions that we've already had people that have emailed in. So if I read them out and then we can collectively answer them, and Sunita's available as well, so we'll just go through the questions. One of the first ones that came in prior to this starting: have any of the studies yet released information regarding health of newborns where the mother have had their vaccine? I appreciate that in the earliest information available, those who had had their vaccine had not yet got to the end of their pregnancy. So yes, when the vaccine was launched, then we haven't seen the back end of that where the babies have been delivered. But currently, at present, there has been no evidence that any babies have come to harm from mothers that have had the vaccine. So on the flip side, there's actually the babies have not been. There's no evidence that babies have been harmed from women that have suffered COVID, apart from those that have obviously more at risk of having a preterm delivery. So that's that information. Anybody else want to add to that question? I am just seeing. So the next one, I have a few questions in advance of the broadcast. Does the vaccine cross the placenta? So, and does the vaccine give immunity to the baby? Is it safe to have the vaccine with someone with a severe food allergy, low PAPA and Hughes syndrome? This is all collected from the same person. I'm just going to read the questions out and then we'll address them. Has the vaccine been tested on pregnant women with blood clotting disorders or severe food allergies? Can the side effects such as a temperature affect the baby? How can I be assured that there will be no long-term effects on the baby? So the last question I think we've just answered, that there's no evidence that by having the vaccine or COVID, there's no long-term effects on the baby that we are aware of at the moment. Apart from the fact that if you do have COVID in pregnancy towards the latter trimester, the third trimester, you are more at risk of having an admission to intensive care unit or becoming seriously unwell, and therefore that can lead to you having a preterm delivery, and then obviously preterm delivery would then equate to normal complications around that, but nothing with regards to COVID or the COVID vaccination. Does the vaccine cross the placenta? Well, in the same way as your body is developing antibodies, in the same way that we encourage pregnant women to have the flu vaccine or the pertussis vaccination, the antibodies cross the placenta. So therefore, there is some evidence around the fact that the baby does form some immunity from antibodies to COVID. And therefore that, then it gives it, that's the next question, gives it immunity. Now, Hughes syndrome and low PAPA and the severe food allergy, there's no indication that the vaccines aren't safe for those. It's an antiphospholipid condition, and it's not going to show any side effects from the vaccine, that you cannot have the vaccine in pregnancy, or if you weren't pregnant, you couldn't have the vaccine. Low PAPA is an indication, and food allergy wise, it shouldn't indicate any concerns either.
And can I just comment
on that?
Yeah.
So obviously, if a woman's attending for her antenatal appointments, she can always have a further discussion with either her consultant if she's considered high risk, or with her midwife, to get some more information around, you know, whether they should have the vaccine or not. But like you've just said, for this particular individual, it would be considered safe.
Yeah, great point, Louise. So as we said before, at any stage you can ring your midwife, you can contact anybody to get some more advice on this. It's not just a one-stop shop here. Midwives and your obstetricians and your GPs are available for more advice regarding the vaccine. Sunita, you were going to say something, weren't you?
Yeah, I was going to reiterate that. So if you've got a particular clinical condition and you're concerned about the vaccine, get advice from your obstetrician, and they will be able to advise you on the risk and benefits of getting the vaccine, because it's very important to understand that majority of pregnant women would be absolutely fine to get the vaccine, There is very tiny group of people who've got some allergies or some very rare medical conditions who are not eligible to have the vaccine. So it's very important that you speak to your GP or your obstetrician or your midwife and get that advice before you, and then you'll be able to make that decision, particularly with regards to the questions posed. You know, I've got history of blood clots and other things. It's important to get that information and get that advice from your obstetrician before you get the vaccine.
Cool, we're happy with that question. Yeah.
Yes.
The next one is basically, do you advise women who are breastfeeding to have the vaccine? And on the back end of that, another point to it is, what is the benefit of getting the vaccine whilst breastfeeding if you've already had the disease mildly? Only symptom was loss of smell. The reinfection rate seems to be small and the severity of the disease doesn't seem to increase as far as I know, so the risk of COVID is small based on prior experience. Therefore, how can any benefit of the vaccine outweigh the low risk of COVID? Esther, do you want to address the breastfeeding element of that one?
Yeah, certainly. So the recommendation is that you have the vaccination when you are breastfeeding. If you have had one of the vaccines in your pregnancy and then you have your baby within the period of time between your first and your second vaccine, you should ideally have the same vaccination if you can. But there's absolutely no evidence at the moment suggesting that there is an adverse outcome when a mother is breastfeeding. We know that very small amounts of the immunisation will pass through into the breast milk, and that can only be a positive outcome for a baby.
Brilliant. Anybody else want to add into that? I think you've answered the points though, Esther. The only element to the reinfection rate seems to be small is obviously raising the awareness that we're obviously getting the variant around the areas. So it's also that the vaccine is recommended to ensure you've got coverage to all of those variants at the moment. Anybody else? Sunita, do you want to add anything to that?
So I think again, there is more in the news around this, but what the recent studies have come up from Public Health England and just this weekend actually is that both the Pfizer and the AstraZeneca give us enough immunity to ward off the infection from the new variants. That's now well established, and we're awaiting some more data and information. So I think the answer to the question is, if I take the vaccine, will I be safe against the new variants? And the answer to this point is yes, it's best to get the vaccine to get the antibodies and immunity from COVID virus as itself.
And I'll just add on to that, just tagging on to it, that if you've had your first vaccine and then you give birth and have your baby, it's still really important to have that second dose to make sure you've completed the course to provide you with that level of protection. So it won't mean that you're immune to getting COVID. There is still that risk, which is why we encourage you to wear your correct PPE and using your hand washing, but it's still really important to have that second dose if you haven't yet had it.
Yeah, and I think I don't see that it's listed on here, but I know we had a question raised previously that a lady had had the vaccine in the time frames after 13 weeks, and then was advised that she couldn't have a second dose because that had been the third trimester, and for some reason that she thought she should avoid having the second dose in the third trimester, and that isn't the case. Ideally, if you can have both vaccines in the pregnancy, that's absolutely fine, but you need to follow the regime to get the full benefits of the vaccines, making sure you get those 2 doses.
Jane, did you want to just cover off the fact that ideally from the second trimester onwards, it's safe to have the vaccine anytime?
Yeah, so can you
just cover that off, please?
Yeah, so it's ideally the prime time for a baby's development is the early stages of pregnancy, so up to around 13 weeks, and so the guidance is that you should avoid the first trimester. It's not a given, it's not a rule, but the advice is that we avoid the first trimester, so after 13 weeks. If you've had your first vaccine and then your second vaccine falls into your first trimester, you still follow with your current regime of the vaccine to make sure you're covered in the same time frame, because the trials have all been done based on the time frames of the vaccine being given at certain time frames to make sure that it's effective, and outside of that the effectiveness is not kind of guaranteed or the same, so therefore you follow the regime. But if you're having your first dose, avoid the first trimester. So after 13 weeks, once you've had that first dating scan, you can then have your vaccine as a guide. But any queries to that, if you want to do anything different, again, speak to your midwife, speak to your GP, speak to your obstetrician, and then the advice can be given around that. As a general rule, the answer is after the first trimester. I'm just going to read.
Can I just interrupt you? We've just been asked if you could repeat what you said about how to book an appointment to make sure they get the right vaccination.
Okay. So the current guidance now is that you can book online. So www.nhs, they might put an extra W in by accident there, .uk, and then Google, if it doesn't come up with it, put on, there's a little search criteria in the corner, put COVID-19 vaccination. It brings you to a page. You then look at the eligible criteria and you'll see that it says pregnant and at a certain age bracket or other things, and then it'll fall down to book now. You click on there. At the moment there's a bit of a queue each time. It's a bit like you're attending a concert ticket queue, but you attend a queue that goes through quite quickly, and it gives you the next available appointment with your details in your local area. Now I know that someone's mentioned they've got to travel, and at the moment it's travelling into the Bedford area when they don't live in the Bedford area. If there are any concerns with that, then I would advise you to speak to your midwife and obstetrician, and they can feed that back to us and we can see what happens from there. But ideally, as someone's pointed out in the comments, it is the systems are updating with different appointments every day. As the vaccine supplies are coming in, those the appointments are being released on the system, and that is allocated to the pregnancy specific vaccinations. So you'd have Pfizer or Moderna, unless you previously had AstraZeneca, then you'd be given Pfizer and Moderna. So unless you're booking your second appointment, you'd be followed through with Pfizer and Moderna on that first appointment. So on the website. Yeah.
Jane, can we also book through 119?
You can ring 119. Yeah, you can ring 119 and follow the options. Yeah.
Yeah. So you could also book through 119. The question that was asked around the travelling to Bedford is particularly because Bedford's been announced as an area with the virus of concern. And Liz, I know you've answered that quite succinctly. So I think clearly the recent advice has been, which is I think this morning, is we ideally shouldn't be travelling into Bedford. If you want to avoid that, as Liz said, if you keep refreshing on the website or going to 119, they'll find you a suitable place away from Bedford.
And what we can do is add in the details in the chat where people can put on the phone number as well.
Thanks, Dan. I think that will be really helpful. And Dan, I think what would be helpful also is to put the link to our CCG website where you've got the frequently asked questions as well. That might be also helpful.
Yep, we'll do that.
Thank you.
I'm just reading another question, but we've covered that one as we've gone through it. So I'm just going to move on. Is there any other questions in the chat, or are we just going with the ones we've already got pre-documented down?
I can't see any that are new, Jane. So if you could keep going with the questions that have already come in.
This one, does it matter which type of vaccine I have, and how do I know which one I'm getting? I'm currently booked for my first dose in Chicksands on Saturday, and then the second one in Biggleswade in August. I'm currently breastfeeding my son and not actively trying to get pregnant, but not actively not trying either. So worrying a little that if I'm pregnant by August, it will be affected if I've gone for the wrong one. I think I'm right in thinking any of them are okay whilst breastfeeding. Yes, so all vaccines are applicable whilst breastfeeding and if you're not pregnant, but it's around the age. Your age will also restrict what a vaccine you will get. If you go online and book, that takes in all of those considerations into place when they book that vaccine, when you book your vaccine. If you have any queries over what vaccine you might get, I'd probably advise you best to ring 119 and speak to somebody rather than doing it online, and then you can obviously speak to them about what your concern would be, or if you want a certain vaccine over another, then they may be able to look at booking you a vaccine of one choice over another. Anybody want to add anything else to that? No. I don't know whether or not, have we got any kind of common questions that we've had come up that we can just cover whilst we're here, or anyone had any other thoughts as to what might come about? I think we've probably made it quite clear that it's quite key for you to get both vaccines to complete your vaccination programme, that it's key to have it in pregnancy to limit your risks, and how to go about getting it on the NHS website or to ring 119. And if you've got any queries, to speak to your midwife, obstetrician or GP. And there's lots of avenues into sourcing some support, whether that be into your hospital, whether it be into your doctor's surgery, or speak to your midwife. So don't, obviously, if you don't get a response on one, try another. But it might be that someone is just off. But we've certainly got a lot of people that can offer some support in advice with regards to the vaccine to you.
And I would just add on to that, Jane, that obviously each contact you have whilst you're pregnant or after you've had your baby, we will have that conversation with you to say, if you haven't already had it, you know, what your thought processes are, to make sure you've got the right information to be able to make that informed decision, because we know at the end of the day it is an informed choice, but it's about having that conversation to understand the reasons why if you're choosing not to have it. And I'll also add on to that, in terms of your care whilst you're pregnant, even if you do find that you are COVID positive, please get in contact with your midwife. It's really important that you are still seen whilst you're pregnant, and particularly if you've got any concerns such as movements being less than normal or a change in pattern of movements, so you can still access the same level of care that you would do if you weren't COVID positive, but it's just making sure you're getting the right care at the right place at the right time.
Yeah, that's really key. Thanks, Louise. And that does sit across all of the hospitals across the BLMK, so that would apply for Milton Keynes and Luton, and obviously Bedford, where Louise and Esther are based. But any concerns at all, do you just ring in and or contact your midwife or speak to somebody. Don't sit on anything that you're worried about. And certainly don't, if you did have a vaccine and then you started to feel unwell afterwards, don't put it down to just having the vaccine. Make sure you do seek some support afterwards if you need to.
So Jane, can I just that follows on beautifully to what I was just about to say, and is that some women may find that after having the vaccination they have some side effects, and evidence suggests that they are very mild.
Yeah.
But just by talking amongst each other, you find that they can vary considerably.
Yeah, definitely.
Just to reassure mummies who are breastfeeding that it's absolutely safe to take paracetamol. Obviously, if you're not allergic to that, and that will just help ease any discomfort, especially if you've got some in the actual incision site. You can end up with a bit of a numb arm, but it's absolutely safe to continue to breastfeed. Now, if you do feel so unwell that you don't, it's important to make sure you've got the support around you in that first instance. So make sure that on the day that you're having your vaccination, that there will be someone around, especially if you've got other children, so that someone's there to support you, to look after them. It's also to, if you are expressing your breast milk, what you might find helpful is a few days beforehand, express a little bit more, just to take the edge off. So if you are feeling very unwell post vaccination, you've already got a backup supply to continue to give your baby breast milk. What we don't want is for you to start reducing the number of feeds that you give baby, or reduce the frequency of expressing, because that could have an impact on the amount of breast milk that you then subsequently produce. We want to maintain that production. The other thing also is that some people have raised concerns about being told that they shouldn't breastfeed for the first few hours after having a vaccination, or if they are expressing that they should discard that breast milk. There is absolutely no reason you should do that. Continue to breastfeed as you would do normally, and if you are expressing, that breast milk is absolutely safe to give to your baby.
Oh, brilliant. Thanks, Louise. That's great information. Very good. Sunita, do you have anything else you want to add? Any points that you've known that people have raised that we want to just cover off again? Or
there are two more questions in the question box. If you just one around a previous miscarriage, and a slightly off-topic question about when will two birth partners be allowed in Milton Keynes.
I'm just reading this question. I might have missed information on this, but I have previously had a miscarriage and a few scares bleeding in the pregnancy. Is the vaccination still recommended during pregnancy? Currently 31 weeks. So, Sunita, do you want to cover this question? or do you want me to go ahead?
Yeah, so as we've been saying all throughout the webinar, we will not be able to know your individual circumstances and your individual conversations. So far, we know very, very, very tiny number of people have contraindications to the vaccine. The vaccine is safe for majority of women, and including when they're pregnant. However, this discussion you need to have with your obstetrician and get the right advice around this. Reading from what you've put on what the presentation there is, ideally it should be okay. However, you just need to have that risk assessment discussion with your obstetrician to get the right advice, and then definitely make that decision yourself, because it's a clinical decision and that you need to make.
Yeah. So that probably reiterates what we've said previously, and the fact that if anyone's got any personal concerns with any personal circumstances, ring your midwife or your obstetrician and get them clarified, and then book in for your vaccination appointment. Don't book in for your vaccination appointment and expect the vaccination centre to answer these questions, because they're not going to be able to answer them. It will be your obstetrician, your GP or your midwife who'll be able to direct you to the right information, and then you can make that choice and book the appointment after that. But great question, thank you for raising that. I have just seen obviously the one at the bottom there that says slightly off topic, is there any chance of 2 birth partners being allowed in Milton Keynes shortly? I think visiting rules and regulations are being reviewed all the time, and so that will be something that will be communicated out shortly if that's possible. But obviously we were trying to weigh up the risks and benefits of that at the same time, to yourself, to other patients, and obviously with the current restrictions within the COVID regime as it is at the moment. So hopefully, fingers crossed, but keep a lookout on the social media and ask your midwife. It should be changing as lockdown changes. Fingers crossed. Anybody else got any other points? Anything that we haven't covered? I'm sure there's something that's probably screaming right in our face that we haven't covered that's obvious, but I think we've tried to cover the majority of the information that we have available. As we said before, the RCOG website is brilliant for information. The Public Health England website is very key, so .gov.uk, and also the NHS website has some great information on there and factual information on there for you to look up and have a look over. Anything else?
So just one thing, which is probably it's important to just cover off here, and Esther and colleagues, Jane, do come in, is that I think we've been trying to get messages out. So if you are in a family and you're socially isolating because of symptoms, or somebody's tested positive for COVID and you're pregnant, please contact your midwife and tell them that you're socially isolating with somebody who is positive, who's tested positive, or who is symptomatic. We need to know this so we can give you the right care as well. It's very, very important. We need to know this. I know it's kind of tangent and it's relevant to this, but it's very, very important that we know that as well. So an important message is to take. We've got mums who probably don't have English as their first language. And Jane was saying there on the links that we have posted, you will find information on majority of the spoken languages in the United Kingdom. So the pregnancy vaccination, COVID vaccination in pregnancy information leaflets are available in all possible languages. So please use those. And if you know of mums who will benefit from them, again, please drop us or contact us through our contact pages through the CCG, and we should be able to get that information out to you. Dan, Liz, do you want to promote our frequently asked questions? Because I think that's a really helpful resource, because that our CCG website is very helpful as well. Over to you, Liz.
Sunita, Dan's already put the link up on the Q&A session, so that's there for anybody to have a look at. Just put BLMK in your web search and it will immediately come up with our website, and frequently asked questions are clearly shown from there. There are no more questions on the Q&A on the question slide, Jane and Sunny, so I don't know if you want to call it a day now.
Yeah, Liz, I was just thinking, obviously this is going to be recorded for us to play out to people afterwards. Can we keep the link open for the questions, or does that close down now? For anybody that's got any questions about the webinar.
So I was going to say the link for the questions is only available whilst the event is live.
Okay.
So when we post the link to the video and also the slides as well on the website, we should really give people an opportunity for them to be able to contact, whether there's an email address that people can contact.
There is.
Turns up.
We can put the comms email address up again, which is what we did before.
Okay.
Brilliant. That's fine then. That just covers the confusion. Lovely. Well, thanks everyone. I think we've covered everything. Anybody else?
I think thank you very much for the panel who's helped us to put this program together today. Thank you to Liz and Dan for your fantastic support, and thank you for the fantastic questions from our mums. We are always wanting to be in touch. Please don't shy away in asking any questions. Please stay safe and please get your vaccine. Thank you very much.
Nice. Take care.
Bye.
Bye.